I gotta do the people first. Right. I was talking. Sorry. Okay. And there's me too. All right. 3, 2, 1.
According to the National Institute of Drug Abuse, most abused drug in America is prescription drugs. As far as depressants are barbiturates, benzodiazepines, and sleep medication are the most abused depressants. As for opiates and morphine derivatives, codeine, morphine, and methadone, stimulants, amphetamines, and methylamphetamine. Okay. We generally want to be healthy, and when we're ill, we try to look for a cure. But when does it become more about treating the symptoms over treating the illness? In today's world, it's easier to take a pill than just to go to therapy. So some questions to consider while you listen. How many people do you know that have a prescription? How many are more than one? And how many are using another prescription to treat a side effect of another one? Today I'm going to discuss how psychologists, psychiatrists, and some primary care physicians are contributing to the drug abuse in America. If you notice, before a lot of the drugs that are being abused are psychiatric drugs. All right, so I'm going to share some issues with prescribing medications, some solutions, and some actions you can take. First, we need to look at the problem. We want to live well-adjusted lives in society. And that seems kind of hard whenever 1 in 5 patients are on 5 prescriptions or more, and 1 in 5 of Americans are on psychiatric medications. With these psychiatric medications, you have a lot of side effects and withdrawals that you have to deal with. One example is lithium. The seizures, excessive thirst, blackouts, and hallucinations are just a few of the potential side effects that you could deal with. The National Institute of Mental Health website offers detailed information on different types of prescriptions, their side effects, and the possible withdrawal symptoms. In order to make informed decisions, we need to be fully aware of what we're going to be putting in our bodies. So what we need is basically we need a basic knowledge about the field of psychology. Whenever I say this, it's more about focusing on how diverse it is. Not all doctors are going to treat you the same. A study by Dr. Lane showed that 80% of people on antidepressants didn't screen positive for depression. By a study by Dr. Lefevre and some colleagues said that ADHD diagnosis varies so greatly across the United States that there's potential for overdiagnosis and over-medicating children. Whenever one at ADHD, as I mentioned before, the medication can cause things like insomnia, anxiety, depression, so then your child is going to be taking more medication for it. That goes for adults as well. Some firsthand, sorry, I lost my place. A few factors we need to look at whenever we want to solve this problem is the brain is not fully developed until the age of 6. So I think that any doctor who tries to prescribe a mind-altering substance to a child under 6 should automatically lose their license. How can you treat a chemical imbalance if the brain isn't developed yet? Another thing is we need regulations on who can prescribe these medications. I grew up on a lot of military bases, and the women would, a lot of the times, the husbands would deploy, and the women would go to their primary care physician, and they would get a prescription for depression. They wouldn't go to the FRG meetings or anything, they would just go to medication if that was the thing to do. And then we also need to pay attention to restrict doctors who are rushing to medication. A lot of these doctors, as soon as you go in, they want to put you on medication and then do the therapy. And a lot of times you don't necessarily need the medication, just need the therapy and the coping to deal with it. Lifestyle change therapy has shown to have an 80% success rate in the first 6 to 8 weeks. And the behavioral therapy, these type of behavioral therapies can take years, but people expect 3 to 4 months, so they're more prone to rush to medication. But side effects. To help with this problem, we can educate ourselves and be aware of the options. Just because one doctor suggests something doesn't necessarily mean that's the only thing you can do. Like I stated before, there's usually something else there, like diet, exercise, the way you eat, just all kinds of stuff can impact your mood and how you behave. Different professionals do have different perspectives. Not all of them are going to specialize in the same therapies. They're not going to want to treat kids the same. Another thing that a lot of people don't know is a lot of things that dealt with evolution have been incorporated into biology and psychology, and a lot of doctors aren't up to date with it because they went to school, say, 10, 15 years ago. Lessening the availability of the drugs should help decrease the drug addiction. Not giving it out as much, so less people are going to be prone to taking it. You won't sell it as much because I know some people would sell their prescriptions. Another issue that I've noticed is drug addiction leading to misdiagnosis of it. I'm going to use my sister Amber as an example. When she was 14 years old, she started doing meth. Since Amber was little, she never really had any consequences. She wasn't disciplined properly. So as she got older, even through the court systems, she still did what she wanted to do. So finally, whenever she was about 14, she got in with a 20-year-old guy, and courts wouldn't do nothing about it. So 3 years of this, she had drama. She went to rehab and was diagnosed bipolar. Amber's not bipolar because she only reacts a certain way around certain people. And now that she's been 17 and moved out of my parents' house, she doesn't live by their rules, so she's not acting the same way. She doesn't have these symptoms of bipolar disorder, but she did start taking pills, so she's addicted to pills now. Another issue is not listed side effects. My brother, he had a violent reaction to medication where he had an episode and tried to attack a bunch of people. They put him in a psychiatric clinic. For 4 days, it took them to realize that this was a side effect of a heart medication he was on. My mother, she was diagnosed paranoid schizophrenia when I was 9 years old, and it took 16 years for them to find out that she didn't have a chemical imbalance, she had a hole in her heart. So she has a lot of medical issues now because of the pills they had her on over the years. Now, if I can name off 3 people in my immediate family that has been misdiagnosed, how many other people out there are suffering with the same issue? You may be thinking what we can do as college students to try to prevent this for ourselves. First of all, I want to make it clear that not all medications are bad and not all diagnoses are bad. That would just be ridiculous to claim that. But be aware of alternative views and treatments. There's always something else out there. Take a course. I personally find psychology very interesting because I was a psychology major. And, well, they have Psychology 101, Psychology of Adjustment coming up in the spring. I would recommend Psychology of Adjustment. It was my favorite course. I had Professor Dawn. She gave me a new perspective on the drugs in America and how your body naturally reacts to certain environmental factors. As far as whenever you go to a doctor, ask any question you can, whether it's related to the medication, the diagnosis, alternative treatment, and there's always the option to get a second opinion. There's nothing wrong with that. I actually recommend always, if you don't feel that you are comfortable with the information you're getting, go to somebody else, see what they say. Some other things to look into are see how diet and exercise and too little or too much stimulation can actually affect the human body. That's one big factor that a lot of people really aren't aware of. Sorry. Okay, basically the more you know, the better questions you can ask. So I'm not trying to get anyone to, completely give up medication in the field of medical science, but just ask questions. Know what you're putting in your body. That's it. Good job.
Alrighty. Okay, Mr. Dennis, you